Hi, good afternoon. How are you doing today? I am so happy. I hope you all can tell how glad I am every time I have to do this. I am so excited. Thank you for joining me. Thank you so much. In order not to waste our time, I will be talking a little bit about strokes. Now, for today, we're going to do things a little differently. I put this down. We're going to do things a little differently. So, how we'll do it is you're welcome to ask your questions. I'll try to read the questions, and then if you have any concerns about any of the things I'm going to be talking about, please try to reach out to me. Um, but in the meantime, I'll just go straight up to what we have today. Okay, let me see. All right, so I'll be talking about strokes, and this is not to scare you in any way. Okay, this is not in any way to scare you or to get you running to the doctor's office for something, for one thing or the other. But hey, this is what you need to know. It's very important, and as you remember, the goal is not to treat you. The goal is just to help you identify some of these illnesses or diseases or conditions, and then that way you know exactly what to do, and at what point you need to take precautions or go to the doctor's office and all of that stuff. So I'm gonna go straight into what we have for today. So some facts about strokes. Okay, now an estimated 17 million people die of cardiovascular diseases, especially heart attacks and strokes every year. This is according to the World Health Organization, the most current for this year, 2020. Then someone in the US dies of stroke every 4 minutes. So in every hour, you have about 12 people dying. 15 people dying of strokes. So this is something that is very, very important that we all understand and we all come to acknowledge that it's a possibility, regardless of your race, regardless of your gender. Thank you so much for joining me. Ifeanyi, thank you. Chimaroke, thank you so much. I'm so excited. All right, so I'll be talking a little bit about strokes and what is stroke. I'm sure you must have heard, someone talk about stroke. Oh, I had a stroke. My father had a stroke. My mother had a stroke, or something like that. Now, stroke is just, it's just a fancy word. Maybe not fancy. It's a more scary word. Okay, it's not like maybe it's like a heart attack or something. And then the body, the blood vessels, stop, pumping blood, or they're not able to, blood is not able to flow through the arteries. Pretty much, that's what it is. So there are so many things that could cause a stroke, and that's why I'm actually having this conversation, this presentation today. So some of the risk factors for stroke. So you might sit there and you're wondering, oh, am I going to have a stroke? Am I ever going to have a stroke? My parents never had a stroke. My brothers never had a stroke. My church people never had a stroke. That is what I hear all the time. But hey, anybody could have a stroke regardless of the age, okay? Regardless of your sex, regardless of your religious affiliation, regardless of your ethnicity. Anybody can have a stroke. So I want you to, I'm going to be, bringing to you some of the risk factors, some of the things that actually place an individual at a high risk for stroke. Now, the first thing is, thank you, Joan. Thank you so much for joining. Thank you, Rhoda. I appreciate it. Wow. Thank you all so much for joining. This is getting really interesting. So some of the risk factors for stroke include a history of high blood pressure. So especially now in the COVID season, everybody is anxious. A whole lot of things are just not right, and you feel that your blood pressure is going high every now and again. Now you need to take a break and assess yourself. You need to take a break because you might be at a high risk for stroke. And the other thing is diabetes. A few weeks ago or last week, I actually talked about diabetes and how it affects some of the small blood vessels in the body. So diabetes pretty much destroys the small blood vessels. And what happens? The blood vessels are the ones that carry blood from one part of the body to the other, especially from the brain and all of that. So if you have a history of diabetes, if you're having high blood sugars, then there is a tendency that your blood vessels might have been damaged, and that might cause you to have a stroke. Also, cholesterol. Yes, cholesterol, high fat in your blood. Now, if you've gone to the doctor's office and they say, hey, your cholesterol is high, You need to start working on it. You need to start exercising. That is very important. I don't want you to play with it. I don't want you to take it for granted, because it is very, very important. The other thing is obesity. Now, obesity, high cholesterol, yeah, we can put them all in the same family. But hey, hey Ugoma, thank you so much. Hi, yeah. So obesity can actually increase your risk for a stroke. Okay, so 1 in 3 adults have at least one of these conditions. So it's either they have diabetes, or they are obese, they're big, or they have a high blood pressure, or they have high cholesterol, or they have a family member that has actually suffered a stroke. So this could put you, an individual, at risk for a stroke. The next thing I want to talk about is a history of atrial fibrillation. Now, that's a big word, but hey, it is just as easy as you can imagine. Thank you so much, Mr. Adeola. I really appreciate you. So, a history of atrial fibrillation. Now, in the heart has 4 chambers: the right atrium, right ventricle, left atrium, left ventricle. So in some individuals, you find out that the doctor says, oh, your heart is not pumping well. So typically your atrium is supposed to be squeezing hard. So when blood comes from the from the upper superior, it's the vena cava. I don't want to use all that word, but when blood comes from the top, from the head, and from the from the lower part of the body, it goes into the right atrium. Now, if that right atrium is not, if the vessels are not squeezing really hard to push down blood to the right ventricle, and then to the left ventricle, to the lungs, and all the way back to the left ventricle, there is a possibility that that blood pulls in the right side of the heart and begins to clot. So if you've ever had the doctor say you have atrial fibrillation, it means that you have a high risk for blood clots, and then consequently a stroke. So that's really what it is in that area. So if you're having, your heart is palpitating, like, what I mean is, you exercise, or you don't even exercise, and you feel your heart beating so fast, like it's gonna pop out of your chest, then you might need to go see a doctor for, stuff like that. All right. So I already talked about alcohol, smoking. Smoking damages the blood vessels. Family background. So if you have a parent, if you have a first-degree relative, your brother, your sister, an uncle, your parents, a child who had a stroke, then you might need to go see the doctor, or you might as well just start living a healthier life. How about that? Thank you so much, guys. I really appreciate. Thank you so much, Ngozi. Thank you for joining me. Thank you so much. Now, I'm going to talk about gender. Very important. Women have a higher chance of having strokes, but men die faster. I don't know if that makes sense, but hey, women have, a tendency for having strokes, but men die faster. So the thing is, it's all about managing symptoms, pretty much. So women have a highest risk for stroke, but men die faster. That's what it says anyway. All right. So the next I'm going to talk about is the signs and symptoms. So what are you going to be looking out for? How do you know if someone has a stroke? Or someone just, fell down, and then they're beginning to, they tell you, oh, I can't feel my hand, or I can't feel my leg, or my face is, going numb, or, they're talking and you can't hear what they're saying. Then yes, you need to watch out, because something might be really going on. So the first sign is sudden numbness, and I'm going to give you an acronym after this. So you just, if you have that at the back of your head, you can actually identify when you see someone having a stroke, you can say, hey, this is exactly what's going on, and this is what I need to do. So sudden numbness, thank you so much, Nicole. I really appreciate you. You're such a wonderful lady. Thank you so much for joining me. So the first thing I want you to know is sudden numbness. So an individual all of a sudden becomes numb. They can't feel anything. The right side or the left side or the both sides of the bodies are numb, and they don't feel a thing. You prick them with a needle, they do not feel it, then something is actually wrong. Sudden confusion, they get confused all of a sudden. They can't understand. You can't comprehend what they're saying. They're forgetting things, and they don't know what's going on around them. Then that individual might be having a stroke. Now, I want you to know this. some people have strokes even with low blood pressure. Okay, it is possible to have a stroke without a high blood pressure. The first thing that comes to mind when someone is having some of these symptoms is, oh, check the blood pressure. And then you check the blood pressure, you're expecting to see blood pressure in the 200s or in the 180s, but hey, you're seeing a blood pressure that's like 130/70 or 120/60, but of course the person might actually be having a stroke. All right. The third one is trouble seeing. They start going, the muscles on one part of the body or both parts of the body become numb and they can't see because the muscles that are responsible for controlling the eyes are, getting paralyzed. The next is sudden difficulty with walking. They get dizzy. Some people get nauseous. They lose balance. They lose coordination. Yeah, some of this could actually be signs that there is an imminent stroke happening. Then a headache. So if you're having a high blood pressure and then you start having a headache, you shouldn't overlook those symptoms. It might actually be something, the body trying to tell you that something is about to happen. Okay, so now the acronym I told you about initially is called FAST, F-A-S-T. And the first thing, you want to act fast when there's a stroke. When you suspect that an individual is having a stroke, you want to act fast because a timely intervention will definitely save the individual, save a lot of the organs, prevents even worse things from happening. So acting fast can help stroke patients get the treatments they need and get the immediate medical attention. So fast, F-A-S-T. All right, the first is the face. You look at the individual's face, you ask the person to smile. Right, when they smile, the face, the right and left side of the face are supposed to move in the same direction, right? But if an individual smiles and only one side is actually moving, then something is wrong, okay? So just ask the person to smile. Sometimes they don't even know, because I've seen a situation where a lady was actually having a stroke, but she didn't know because she couldn't tell. It was somebody else who saw her and said, hey, are you okay? And she was saying yes, but her face was not actually moving in the direction of, what she was saying. So the next thing is the arms. You want to ask them to raise their arms, okay? When you ask an individual to lift their arms, they should be able to lift it up and hold it. But if they lift it up and it falls down back, then something is definitely wrong. The next is the speech. You want to ask them to talk, okay? So when you ask someone to say his or her name, hey, how are you doing? You should expect them to say, I am fine, and that should be audible enough, right? But if they say something and it feels like they're swallowing it or they're not speaking out very well, then they might be having a stroke. That is the muscles of the throat actually numbing up. Okay. Then the last thing is time. Time is of essence when it comes to managing strokes. Time is of essence, because what happens if it's, depending on the kind of stroke, if treatment is delayed, that could actually cause a rupture in the blood vessels, or it could actually cause, oxygen from, not reaching to the major parts of the brain, and that part of the brain can die, and the individual actually is gonna die. Okay, so you want to actually, you want to have this in mind: the face. Ask them to smile, the arms, ask them to raise their hand. If they raise the hand and it falls down right back, then something is wrong. You want to ask them to talk, speech, listen to their speech. Is it coherent? Are they having a hard time pronouncing the words that you're asking them to pronounce? And then finally, time is of essence. If you have an emergency room around, if you can dial 911, if you have, call somebody. Don't just stand there and watch the individual. Call a doctor, call somebody, and get the person to the nearest available hospital. All right. So note when the symptoms appear, because some of the treatments for stroke are time sensitive. Okay. So when when an individual has a stroke, depending on the timing, if for instance, if someone has a stroke, a blood clot in 3 hours, it's going to be a whole lot easier to break that clot and get blood, get oxygen and all of that perfusing than you waiting 12 hours. And then at that point, the organs must have been damaged. Does that make sense? Okay, anyway, thank you guys. All right, so yes, time is of essence when it comes to managing strokes. Okay, so how do we prevent strokes? a healthy diet. I talked about cholesterol being a risk factor for strokes. Eat healthy. I was talking to someone this morning about food, and I said, hey, I will eat anything but in moderation. Yeah, eat whatever you want to eat, but please make sure that you're moderate about it. Thank you, Engineer Chime, for joining. I really appreciate you. Thank you so much. Yeah, so moderation is key. Whatever you're eating, make sure that you do that in moderation. If you want to eat meat, if you want to eat chicken, eggs, if you want to be vegetarian, whatever you do, being what do you call it? Being moderate is of great essence. All right. Now, maintain a healthy weight. You want to be very conscious of your weight. If you feel like you're beginning to add 10 pounds or 10 kg in 1 month, then something is wrong. You need to watch your weight, because that could actually be telling you that something bad is gonna happen soon. All right, physical activities, you want to make sure that you're active. I always talk to people about, thank you, Nicole, thank you, Face. Yeah, that's exactly what I'm talking about, and you just put it right there. Thank you so much because I know some people probably didn't hear me say that, but thank you for putting it out there. All right, so physical activities, if you can, as much as possible, exercise. You don't have to go to the gym and get intimidated by those people with 6 packs and people who can jump, in 100 times in a minute. No, you don't want to do that. Just walk at your own pace. Ride a bike, walk around the neighborhood and stuff like that. Excuse me. Yeah, so you can do all of that. Whatever works for you as exercise, please. It's always better than nothing. Okay. Now, no smoking. If you smoke, you're putting yourself at risk for so many things: a stroke, lung disease, heart failure, kidney failure, and all whatnot. So if you're smoking, I think it's high time you actually think about it. Limit alcohol. Maybe 1 to 2 glasses a day shouldn't be all that bad, because sometimes it's hard to get people not to drink, right? So, but 1 to 2 glasses a day, and just like I said, everything has to be in moderation. Everything. Thank you, Roy, for joining. I really appreciate you. Everything has to be in moderation. Whatever you take in, but smoking, you need to cut it off completely. You don't moderate smoking, okay? All right. So now I'm going to be talking about the different kinds of strokes and what causes them. Now, I will talk about 2 very important kinds of stroke. One is the hemorrhagic stroke, and the other one is the embolic stroke. So in the hemorrhagic stroke, hemorrhagic like blood, whatever, that happens when there is a clot, and then the clot busts, and then blood fills the organs around, or the neighboring environment. That is a hemorrhagic stroke. It just means that there's a bleeding from a burst. So in the brain, for instance, if one of the vessels in the brain gets so enlarged, and most times these things happen because of high cholesterol. When there's, now for lack of better way to demonstrate this, I'm going to show you something. So let's take, for instance, this is a blood vessel. There's no blood vessel this big anyway, so just all right. So let's say this is a blood vessel, and now you have a high cholesterol in your blood. Now the cholesterol begins to build up in the vessels, right? Now the more this vessel becomes occluded by cholesterol, by plaques, the lesser there is room for blood to flow, right? So if you have your arteries piled up with cholesterol, after a while the blood vessel begins to thin up, and there is not enough room for blood to flow. So if you have if an individual has high blood pressure, for instance, it's because the vessels have so thinned up on the inside with plaques that there is little room for blood to flow. So what happens? There is the arteries have a harder time squeezing blood through. Okay, so that's what happens with high blood pressure. Then with strokes, when there is a burst in the arteries, if these arteries start having a hard time squeezing, they're trying to squeeze, but because it's so clogged up inside with cholesterol deposits, plaques, and all that, the artery has a harder time squeezing, and the more it tries to squeeze, the more it kind of stretches, because it's trying hard. So for every squeeze, it stretches, in that same amount. So the more this artery begins to squeeze and has a hard time, then the higher the tendency for this vessel to rupture. So when there's a rupture, blood comes out of this vessel and fills up the surrounding environment. So let's say this is in the brain. This is one of the vessels in the brain, for instance. There's nothing this big in the brain, but just for this. So if this is one of the vessels in the brain, think about it, and then it stretches and keeps stretching and keeps stretching because there's cholesterol, there's plaques in it, there's, it's having a hard time, passing blood through, and then this ruptures. Now the individual has a bleed in the brain, and blood is not supposed to be in the brain, right? So that is called a hemorrhagic stroke. It could also happen in the stomach. We have the major, the aortic, We have, the aorta in the stomach. And sometimes also, like, this works, that's a major artery, and then it expands, it keeps expanding, and then it bursts open in the stomach. And now the individual has blood in an area that is not supposed to have blood in. So that's a hemorrhagic stroke. It's called the bleeding, hemorrhagic, hemoglobin, whatever, however you understand that. Now, the other one is the thrombotic stroke. Now, how do I explain that? So let's say an individual has a clot somewhere. Let me use this instance. I talked about atrial fibrillation earlier and how the heart has a hard time, squeezing out the blood from the right atrium in the one of the chambers of the heart. Now, because the heart is not squeezing hard, some blood remains in that chamber and then begin to clot. So if, for instance, that blood that clots in the atrium travels from the right atrium, it goes into the right ventricle, and then it's supposed to go into the lungs where, it's mixed up with oxygen and then comes back and is, transferred to the other parts of the body. But now, because that clot has left where it started, it travels to the right ventricle and then goes into the lungs, it causes a pulmonary embolism. That is just simple. Clot from somewhere traveled into the lungs where there's not supposed to be clots, okay? And that causes an individual to die in less than an hour. And I've seen it happen so many times. You just be surprised and somebody just says, I'm having difficulty breathing, they start turning blue, and then they die because there was a clot in the lungs where it's not supposed to be. So two major kinds of strokes: when the blood vessels rupture in hemorrhagic stroke, and then when clots travel from, sometimes people with peripheral artery disease, deep vein thrombosis, like some of the vessels in the legs or in the hands, kind of clot, and then have, the vessels are weak, especially from diabetes. When diabetes makes the arteries or the blood vessels in the extremities very, very insufficient or inadequate, they have a hard time pumping blood back to the heart. So there's always room. Many times the blood remains in the lower extremities, and then sometimes there's a clot, and then the clot can actually travel, and then it makes its way into the lungs, and then the individual has a stroke. So these are very important things that I want us to understand. And again, strokes can be avoided. That is why I am doing this. I want you to understand the importance of looking out for some of these things that can actually cause an individual to have a stroke. And like I said, and like my wonderful sister Nicole has posted it on there, please look at it. Fast, face, arm, speech, and then time. All these are very important. And of course, I want you to know the risk factors. I want you to know the things that put you at risk for a stroke and how to avoid them. The ones you can avoid. You can avoid your age, you can avoid your race, you can avoid, your family background. But of course, you can avoid smoking, you can avoid drinking alcohol, you can work on your weight, you can eat a healthy diet, and you can actually take charge of your health. If you have high blood pressure, get a blood pressure machine. Make sure you have a blood pressure machine at every point. Keep it in your house. Now, I want to state something very important, and I know a lot of people do this. My mother does it, and I'm glad she's going to see this video. So, if you have high blood pressure and your doctor places you on medication, that medication is not necessarily an emergency medication. It's a maintenance medication. Now, what that means is you are supposed to take the medicine just to prevent the arteries from overstretching. Now, if you don't take your medication and you have high blood pressure, you're putting your vessels at risk for rupture. So if anything happens, maybe you hear bad news or something happens overnight, now the blood pressure can go so high and then it can rupture a blood vessel. So it's very important, if you're taking blood pressure medicine, please, please, please make sure you adhere to it. Be compliant. You know, it's I mean, I've seen people who have had blood pressure in their 90s, in their hundreds. Well, not a lot of people, but anyway. I mean, really old people, if you know what I mean. So, yeah, I've seen people who are old and, managing their blood pressures effectively or, adequately. And now I've seen younger folks who think they're in, how do I put it, indispensable, and they don't take their blood pressure medicines and then they have a stroke. Now, if you take blood pressure medicines, please and please and please, and if you feel like you're taking your blood pressure medicine but it's not controlling your blood pressure, you need to go back to the doctor. They need to put you on another medication or add something else to what you're currently taking. Now, finally, life after stroke. I always like to talk about, life after, because, yeah, is it possible? Absolutely. So that someone had a stroke, they get paralyzed on one side, they can't move their hands, they can't blink their eyes, or they can't move their legs. So is that the end of it? Oh no, that's not the end of it. With occupational therapy, physical therapy, help that individual use those muscles. It might not return to 100%, the state it was before the stroke, but 9 out of 10 times, yes, they might be able to still use that part of the body. So if someone had a stroke, don't just abandon them. Or if you had a stroke, don't think that that's the end of your life. You can actually start walking, helping yourself, get physical therapy, get occupational therapy to help, with the fine motor movements. And you should be able to come back and at least do 70% of what you did before the stroke happened. So I don't know if there's anything else I need to say at this point. I'm not trying to treat, but of course, like I said, time is of essence. If you had a stroke, the doctors can use a clot buster. There are medications that can break the clot right away, and then that will enable perfusion, that will enable blood to flow like it was before then. And there are medications, or the doctor can actually perform like a stent or a graft, where they bypass whatever spot where the clot or the embolus is lodged. They bypass it, and then and the individual comes back to normal. So in all this, time is of essence. I want you to understand this. Time is of essence. And I hope that this presentation saves a life, which is my goal. I take a lot of time to do this, trust me. And I don't even realize it because I love it. This is what I love to do. And thank you so much. When you're watching, it gives me even more joy. I'm so motivated. I'm so excited. Thank you, guys. Thank you so much, Auntie Nkechi. I really appreciate you. Thank you, Onka Foster. Thank you all so much, so much. I look forward to seeing you all again next week. And until then, I'm going to try to use this to turn this off. Until then, be healthy, be happy, and be very productive. Have a great weekend or a great week. Bye-bye. It didn't work.